Hello, welcome to a student nursing-led presentation on prenatal education, specifically for adolescent mothers. I'm Kiara Maclean, and you'll be meeting the others later on in this video. So in this video, we will be teaching adolescent mothers on prenatal education. More specifically, we will be diving in on what to expect during each trimester, important nutrition information, environmental and lifestyle risks, and resources expecting mothers can utilize for a more positive pregnancy. So why we might need prenatal education? It's because pregnancy and birth complications are the #1 cause of deaths of girls 15 to 19 years of age globally. Specifically, teens under the age of 17 are at risk for poor compliance with prenatal care and have a higher likelihood of complications during pregnancy. Teenage births are associated with decreased education and increased barriers to education, since many are excluded by their peers and community.
Hi, my name is Jovial, and I'm going to be doing the presentation part on the three trimesters of pregnancy. The first trimester, this stage lasts from week 1 to week 12, around 3 months. The stage focuses on changes from a small group of cells to a fetus that begins to show human features. During the first trimester, fertilization occurs, forming a zygote and then forming into a blastocyte. The first trimester also sees the formation of the amniotic sac and placenta. Major organs and body systems also begin to develop, and the heart begins to pulse, limbs form, and bones replace cartilage. By week 8, all major organs are present, facial features, limbs, muscles, and organs also develop. By week 12, the fetus can move, drink amniotic fluid, and its heartbeat is detectable. Additionally, within the first trimester, most individuals develop unpleasant symptoms like morning sickness. During the second trimester, lasting from week 13 to week 28, many of the unpleasant symptoms and discomfort from the first trimester are most likely gone. During this trimester, the fetus can move, suck its own thumb, hear sounds, and react to light. Its skin thickens, hair begins to grow, and external genitals fully form. Additionally, the nervous system matures, the fetus develops melanin in the skin and eyes, and the lungs start producing surfactants for breathing after birth. The fetus may begin moving into a head-down position. Many people are also able to find the fetus's gender during this trimester. Lastly, the third trimester, lasting from weeks 29 to week 40. During this stage, the fetus rapidly develops fat, brain function, and senses. By month 9, most organs are ready except the lungs, which finish maturing around month 10. Bones harden and the fetus gains weight. During the end of the trimester, the fetus will begin dropping to the pelvis to prepare for birth. This can cause uncomfortable feelings. By week 39, the fetus is at full term and ready for birth. Labor can happen anytime, and it's important to monitor movements and watch for signs that are critical during this time.
Hi, my name is Ara. I'll be discussing the role of nutrition through pregnancy. First, let's cover why it's important. So throughout pregnancy, there are times where nutrients are essential for proper fetal development, and we call these critical periods. The most important one I want you all to know is between the weeks 13 and 14 in the first trimester. This is when the fetus is most vulnerable state to nutrient deficiencies and harmful chemicals. Another interesting factor is epigenetics, which studies how genes get turned on or off by environmental factors, including diet. All in all, what a mother eats can directly influence the baby's genes, affecting long-term health outcomes. Each trimester has different caloric needs. During the first trimester, a person normally eats the same amount they would eat when they are not pregnant. The second one needs an extra 340 calories a day, and the third one needs an extra 450. So how should someone distribute their caloric needs? So according to current guidelines, around 60% of your diet should consist of carbohydrates to fuel the developing fetal brain, and it's best to get these from whole foods like brown rice, fruits, vegetables, and legumes, as opposed to processed sugars. 30% of your diet should come from protein, which helps build the baby's muscles, organs, and skin. This can be met through dairy, meats, fish, soy, and eggs. And lastly, around 30% of your diet should consist of lipids, and then there should be an emphasis on unsaturated fats like omega-3s and 6, which are essential for fetal brain and eye development. Moving on to micronutrients, folate is one of the most important nutrients to be aware of. It is so crucial that a person ideally begins taking it before conception. It plays a big role early into the first trimester for neural tube formation. Normally, it's recommended to take 600 micrograms a day. Iron is also crucial because maternal blood volume increases around 40 to 50% to support the baby. The body naturally increases iron absorption during pregnancy, but anemic women are at higher risk of complications, including increased mortality during childbirth. Vitamin B12 helps activate folate and is mostly found in animal-based foods. Zinc plays a major role in cell division, and a deficiency in it can lead to fatal malformations, premature birth, and lower birth weight. Vitamin C supports collagen formation for bone growth and also acts as an antioxidant. And vitamin A is needed for retinal development. Iodine is important for thyroid function and metabolism, while choline is needed for brain and spinal cord development. And so, while good nutrition is essential, it's also important to know what to avoid. Alcohol is a known pterogen that crosses the placenta, causing fetal alcohol spectrum disorders. Caffeine should be limited to 1 to 2 cups a day, since excessive amounts of it increases the risk of miscarriage. And smoking restricts oxygen and nutrient delivery, slowing fetal growth and even reducing the size of the brain. And excessive vitamins can be harmful, especially vitamin A, and so prenatal vitamin formulations should be used instead of self-dosing.
Hi, my name is Nina, and I'll be talking about lifestyle and environmental risks of pregnancy. The expectant mother's lifestyle and the environment they are in during pregnancy can significantly impact the fetus's health. For example, there are many substances expectant mothers should not consume during pregnancy, including alcohol, tobacco, e-cigarettes, and drugs such as cannabis. Just like how your baby will receive nutrients through the placenta also transfers these substances and their negative health effects to your baby. Alcohol can cause a range of lifelong physical, cognitive, and behavioral impairments in the fetus known as fetal alcohol spectrum disorder. Tobacco and secondhand smoke exposure reduce the fetus's chance of survival after birth by increasing the risk of premature birth, low birth weight, and sudden infant death syndrome. E-cigarettes, which contain nicotine, and cannabis can also expose your baby to harmful substances. While most prescription medications can be continued throughout pregnancy, some cannot. Consult with your healthcare provider if you are taking any prescription medications currently. Beyond substances, maternal stress is associated with poor health outcomes for both mother and baby. This includes both emotional and psychological stress, as well as physical stress, such as heavy lifting and sitting and standing for long periods. Expectant mothers can improve their chances of positive health outcomes by eliminating stressful conditions before 24 weeks of pregnancy and using available social supports, including those in the community. In addition to building strength for labor and birth, regular physical activity has been shown to reduce maternal stress and improve physical health outcomes. Expectant mothers are encouraged to engage in 150 minutes of physical activity that they enjoy each week, avoiding high-impact activities where there is a risk of injury or falling, such as contact sports, downhill skiing, skating, gymnastics, etc. Those who are just starting out should gradually increase their physical activity over time.
Hello, my name is Philomena. Today I'll be discussing an important but sometimes overlooked stage of pregnancy, which is the postpartum period. This is also known as the fourth trimester. This phase occurs and lasts 6 weeks after delivery and is a crucial time for the mother as she recovers physically, emotionally, and mentally while adjusting to her newborn. The goal is to highlight the key changes, potential complications, and a crucial educational points to support her and ensure smooth recovery. One of the major parts of postpartum change is physical recovery. The body of the mother undergoes several adjustments, including uterine involution, which is when the uterus returns back to the pre-pregnancy side. It's a natural process, but it's important for the mother to be educated on this. Another one is post-birth discharge, which is known as lochia. This is the change of discharge over time and let her know the amount of discharge she's expected, just so she will know if she has any unusual bleeding, which is a sign of complication. It's important to educate her on the importance of rest. After childbirth, it's important to let her heal. Another one is teach her about the importance of mother-infant bonding, facilitating attachment and connection between the mother and the baby pretty early on is very important. and teach her the importance of self-care, which is very crucial because many new moms may be overwhelmed, and it's important to look after her emotional well-being as her physical well-being as well. Family and friends play a very key role in emotional support, so if she's struggling, seeking professional help can be very beneficial. It's also important to educate her on the importance of potential postpartum complications, which, like mood disorder, is very common for women to have baby blues, but teaching her the difference between postpartum depression and psychosis, which require medical attention. Another one is postpartum hemorrhage, which is excessive bleeding after childbirth, which can be very life-threatening, and teach her signs and symptoms of infection, which like fever, foul smell of discharge, which is important for her to know when to require medical care. Taking care of the newborn is a major aspect of postpartum period, so educating her on the importance of safe feeding techniques and other newborn practices is very important to prevent sudden infant death syndromes. The last one is birth control and family planning. Teach her the importance of family planning and future goal setting.
Okay, lastly, we'll be talking about resources mothers can access, specifically in the Ontario region. So the first resource that an expecting mother can access is called Strive Niagara. It offers the Canadian Prenatal Nutrition Program, also known as CPNP. It's a free, confidential, community-based nutrition program for prenatal or recently postpartum families who face challenges that put their health at risk, such as adolescent mothers. So at Strive Niagara, they provide resources and support in areas such as nutrition, health issues, mental wellness, breastfeeding, and infant growth and development. They also offer both in-person and virtual sessions. They also encourage connections between other parents and provide referrals to other services and agencies within the community. They help to improve the health of women and their babies by increasing the number of babies born at a healthy weight, promoting and supporting breastfeeding. They promote and create partnership within the community by strengthening community capacity, increasing support for vulnerable pregnant women and new mothers, and they ensure cultural sensitivity, prenatal support for Indigenous women and recent immigrants. The line you can reach for Strive Niagara is 905-735-2566. The second resource is Healthy Babies, Healthy Children. It's a free and voluntary home visiting program provided by public health nurses and family home visitors. They are specialized in child health and development, and their goal is supporting optimal prenatal and birth outcomes. So their objectives is to support optimal prenatal and health birth outcomes, improve child health and development outcomes, improve the parent-child relationship, improving prenatal capacity, promoting positive prenatal skills, breastfeeding, food, and healthy nutrition. The number you can reach is 416-338-7600. I hope you enjoyed this video. We would definitely like to hear from you, so please share in the comments 3 things you learned in this video, and we can reply with our answers. If you have any specific questions regarding your health or prenatal education, please visit your local health provider. Thank you.